Thank you, Dr. Sabina, for your kind words as well as for your invitation to this instruction course. I'm feel so proud. In fact, maybe Diksha is the first one who started doing ROP as far as when I started sort of training people with me. I think I was just trying to recollect, but you are the first one. And subsequently, of course, it's a journey itself. I do have financial disclosure. These days, I do serve as a speaker as well as sometime a consultant to Bayer and Largan. So basically coming to, since she wanted me to share a little bit of my journey with ROP, my journey with ROP started in 1989 in Baltimore, Maryland, USA, where I was doing my vitreoretinal fellowship. And I started screening and treatment of ROP in PGI Chandigarh. That is where I worked all my life in July 1991, when I came back. At that time, there was no awareness of ROP among ophthalmologists, pediatrician, neonatologists, obstetrician, even the parents, nurses. I mean, it used to be one-liner, lentil fibroplasia somewhere. So for me, the father of ROP in India is Lingam Gopal, because he was the first one who started when probably I started seeing these babies in USA. He started seeing in India. And I remember when he came in 1990 with his first poster of coloboma RD to the academy, he told me that I should concentrate more on ROP. He started seeing some cases. We are contemporary. We did our residency together in PGI. He's a PGI product also. And this is way back. We did one course in Agra, AIOS, which was full hall. So over a year, we have grown, and so is probably the specialty. So it's really, I consider him as the father of ROP in India. I used to do initial documentation with video indirect. There was no way. And I'll tell you, it was very interesting for me. Those days, these images were shared by not people in India, by across. Some of the celebrities I don't want to name, from China, from Indonesia, and even from Vietnam. They all used to take all these by slide, because that time, hardly these images were available. And these were all video indirect images. And you know, it's very coincidental that cryo ROP study results came in 1989, and that is at the time I started seeing them in USA. And when I came back, I did cryotherapy for threshold disease from 91 till 97. And it used to be done under GA. Difficult time. Even our anesthesiologists, they used to be very angry with me. What have you started? They'll take half a day for one baby to be in and out. It was such a challenge. So lot changed. From 97 onwards, I did laser, because we could acquire our first laser, diode laser. And of course, now the lasers are continuing still. You can see this was 95, this twins I cryoed. You can see very well that cryo scars. I think I've used to cover very well. You can see here, the arcade are little narrow. The vision, despite being one high myope, another one is not that high myope, is 6'6". And they are both pursuing and brilliant girls. So during my entire journey, 90% of the thesis, I think, of course, Sabina's thesis were different, diabetic retinopathy. But after that, I don't think I did, there was any other thesis except it was ROP only. And this gave me a lot of opportunity, especially to look at ROP relevant to our country and to the most developing world. That is what I feel very good about, that whatever work little we could contribute is totally relevant to our needs. So this is the first one. First thesis I gave way back in 91, 92 to Rohit Charan. He doesn't do, he's in Jaipur. And this was a first prospective study. And back to back that time, me and Lingam Gopal published first time. And the incidence, his was a retrospective hour. So this is in IGO in 95. And you can see the problem was as big as in Western countries, 38%, 47.27%. And this is the most kind of important thesis of life, because this was my observation, that higher birth weight babies are developing more and more ROP. And this I gave to Anand Vinekar, the famous Anand Vinekar. And so he stayed with me for 6 years. And this is the paper. I think you will have to work very hard to reach the citation of this paper. It has on Scopus 124 citation. Google Scholar more than 200. So for a paper on ROP, you will have great difficulty having that many citations. So that not only that, it helped to change the guidelines for our country. You see, that is how we could convince. Pediatrician, neonatologists were not convinced. And that's how we came to 2 kg in 34 weeks rather than following the Western guidelines. Also, this was by great difficulty. I had this elderly parents, handicapped, and their only girl child couldn't be taken out of the incubator. That's how I started and treated that baby in the incubator through the wall, and lasered through the wall. And this came as a great tool during COVID times. Even based on this started receiving more citations because they started making contraptions. They did make many of them for this. So sometimes your contribution plays a great role. Another thing which bothered me, first diode laser in 97 we could get with great difficulty. We used to have green laser, and we were sure that green laser should work equally well. But the problem was that Western country would say diode only. That was a problem. So first time we did collect our laser conked off. Once the laser conked off, we had to do something. So we started, and that time Anand was there. That's how Anand is still part of that paper up there. And we published then in BGO 2010. You see, it worked equally well with whatever was said earlier. If there is a TVL, there's hemorrhage, there'll be cataract, there's no. And the results were similar to the diode. We compared it. And later on, I told them to compile this before my retirement in 2019 in the IGO bigger series so that we have a full confidence. Today, that laser, one laser, which is used for all other needs, is used for ROP. You see, that is the biggest need of all developing countries, where you can't say diode laser is required separately for this kind of thing. Then also another observation I had, that most of our cases, they were aggressive posterior ROP, especially coming from periphery. And that was not so. In Western country, it was quite small. So when they changed, previous to this classification, this 2009 retina paper was the first one. This was even before Dressner and Michael Tracy had a paper in 2010, subsequently. That because we had more cases. And we highlighted this point, that there are higher birth weight babies, and that is what subsequently even we could, we published in AJO regarding who develops retinal detachment. And also then we thought, why not to publish this? The last paper is now receiving more citations, because many of them they are developing once they are more than 1500 grams. This hybrid ROP, I used to write on the file. This was by drawing. I was not able to kind of mixed ROP, something I used to write. So all the time, first Anand, and then Gaurav came with me, and then in between, I also had a few others, those who, they would say, and you have drawn it differently. I said, they don't fit anywhere. So I named myself a hybrid ROP and sent it for publication to BGO. This is one publication which didn't receive any revision or any kind of thing. They accepted straight away. So you see, today I feel proud. This is one of the papers which changed your new classification. They never wanted, there was a debate. They never wanted to name it as hybrid, so they changed it to aggressive ROP. So this is based on this paper, so which is a great achievement, at least for me, for an observation. This is posterior zone 1. This was another one. We have this zone half, whatever. This is the only full publication. You will find either a part of other papers earlier, before this. And I think then Anil and others have published looking at this only. But this also, they did debate, but I'm surprised why they didn't include this posterior zone 1. They included posterior zone 2. Yeah. But what is the importance here is, you must realize that almost 80%, 79% of them had unfavorable outcome with laser in our setup. That is why we wanted to publish it. So they need early aggressive multimodality treatment. I think that is why ultimately we landed up into, since she wanted me to talk about also how we have reached, is anti-VEGF for ROP. And once the anti-VEGF came, we know zone 1 and AP ROP always had a problem. So many of them, they have become indications now for the anti-VEGFs. And disease may progress despite laser. We have seen this. These days we tend to do also in many of them surgery, lens sparing, and rescue therapy when ophthalmologists are not available. And then lens sparing vitrectomy is something which is very, very close to my heart. I think I have done quite a bit of lens sparing vitrectomy. You can see one such case here where we could salvage the, and then this is my last part of the journey there, partial insertion of the cannulas. And just do that, you will not touch the retina ever. And of course, the nasal, all nasal, this has been described first time by me. This was the last one published in Retina 20. And you do in the temporal RD, you save the lens all the time. That is what you need to do. Here you put cannula in the center and go from the side. I'm not showing you the video. And of course, stage 5 always bothered me. And we published in Ophthalmic Epidemiology. Because of this reason, I must have gone. I never refused anywhere, wherever I was called. All my career of more than 30 years in ROP, all over India. I went even to remote areas just to make people. And we were part of the editorial, me and Anand, along with our neonatology professor, Datta, and Raghuveer, who's very passionate from USA. We wrote an editorial, what are the causes. So I could have 54 publications, conducted workshops. I'm one of the National Task Force members, lot of lectures, 18 orations I got on ROP. So these are all the National Task Force members here. So you can see these are nominated by the government, Government of India. So I could interact with all the big people. I became friendly with them. You can see here Michael Tracy. You can see in the center there Michael Chang. You see, he's the director of NEI now these days. A very great person, a lot of work done by him. And you can see also Michael Subiro down. So I think here, starting with Subina, she's in the corner. They worked with me. They all practice ROP. There are many more. I didn't have pictures here. And here is, of course, Dr. Diksha also on the other side. And she does a lot of ROP work. And she is the one who's carrying on along with Simar down there. So even when I retired, they had a full issue on ROP dedicated to me with the editorial written by Santosh, that this is because I worked in that area. And most of the articles I was part of when they wrote for Indian Pediatrics full supplement. There is something to do with my institution and ROP. You know, all the stalwarts here, they have been all product of PGI Chandigarh. That is where I worked all my life. And you can see these are the people. They have made whole difference as far as the ROP is concerned. So thank you very much, friends. I thought it will serve as little stimulation for some of you, those who are here early morning.